into the office today. Let me just get your name and your birth date, some other information that I'm going to need just to confirm I have the right person for the right appointment. And can you also just confirm what you came in for today? So let's start with your name. Okay. Okay. And your last name, please. Okay. And then let me just make sure that, yes, we do have you down. What was it that you were being seen for? Neck pain. Okay. Alright, yep, that matches what we have here. So you were looking for some adjustments and then a massage after? Okay, yes, you're in luck. We offer both of those here. So okay. Can you go ahead and describe where you are feeling the pain? I know, like, it's the general area of your neck, but can you tell me if, like, you feel anything radiating to your shoulders, or does it go further down your spine into your skull, perhaps back of your head? Okay, so more centralized to, like, you know, here. Okay. Radiates a little bit to shoulders. Okay. Alright, so did you have any injuries that may have triggered this, or is it just, did it just start one day and you just don't know why? Could be because of how you sleep, yeah. That is definitely a possibility. Can you describe to me how you sleep, maybe? And what kind of pillow you have? Okay, so you might not be getting enough support then when you're sleeping. Is your head more like... Okay, yeah, so you might need a firmer pillow, actually. But I, of course, will perform some adjustments and do a little bit of an assessment. And we can go on from there. And then I'll take some notes and pass them on to our massage therapist, Louise. And she will kind of work in the same areas I did, but the massage afterward usually helps just to kind of loosen everything up, so, you know, you don't feel stiff or uncomfortable after the adjustments, though that is very rare. The massage just, you know, helps. Gets a lot of the blood flow to that area too. So, I'm just going to assess your neck. Can you go ahead and turn in the chair for me? Thank you. I'm going to feel the base of your skull here where your spine starts. And just kind of work my way up and down a little bit. So there's no pain here at all where I'm touching. It starts like here. Okay. But nothing here. Okay, I'm just gonna kind of feel around and mess with your head a little bit. Do you feel any pain when I move your head like this? Not really. Okay. So you're saying here. And this is when it moves into your shoulders? Okay, yeah. me just do some more feeling here. Okay. All right. And I'm going to apply a little bit of pressure, okay? There. Okay. And let me try just pressing, oops, sorry, bumped you a little bit. Let me try just pressing along your spine. Do you feel pain in the muscles? A little bit. Okay. Just, yeah, you do have some tighter spots and some spots that feel a little bit locked up. Can you go ahead and stand up and just walk a little bit across the room and come back for me? Yeah, I need to see your gait and how you move and if anything is off. So, okay, yeah. Thank you. Okay, do one more time, please. Yeah, it looks like one of your shoulders is a little bit lower. Go ahead and take a seat again. And so when I put pressure on your shoulders, does that hurt at all? Okay, just a little discomfort then. Okay, go ahead and spin around for me again. And I am just going to start with some pressure on certain areas. Just pressing and releasing. Yeah, you might want to take deep breaths as I'm doing this, like hold it while I'm pressing and then release it as I let go. Okay. And release. Release. Okay. Now I'm going to put my fist into your back, okay? And I'm going to grab your shoulder here and pull it back. Same thing with the breathing. Okay, let's do the other side now. Same thing. And let it go. Alright. I'm gonna just it wasn't any lower, right? The pain was not any lower. Okay. Yeah. I'm going to use this gua sha tool to kind of loosen up your muscles here a little bit, just so I can see if releasing the tension in the muscle helps with the lopsidedness of your shoulders at the moment. Okay. Is that feeling alright? Okay. Just okay. Now I'm going to move your head so you can just relax, just stay loose, so that way I can turn you a little bit, okay? So I'm just gonna take your head. Okay. Alright, and then back the other way. Okay. Alright. How did that feel? Okay. Yeah. Yeah. Alright. Now we're gonna do that again. And remember to breathe in when you feel me start to move you. We'll do that, okay? So breathe in and out. Okay. And same thing going the other way. Breathe in and out. Very good. Okay. Now I'm going to do some pressure, and I'm going to push a little bit harder this time so that way we can release some of the air pockets or just locks in your spine, okay? So we're just gonna do that. Press and breathe in. Okay, and out. Okay. Alright. Breathe in and out. Okay. Very good. You're doing a great job. In and out. Okay, very good. And just similar to how I did my fist earlier, I'm going to put my hand on your back here and grab your shoulder and kind of tug you a little bit. Okay. And breathe in and out. Okay. Same thing here. Do it again. Breathe in and out. Okay. Very good, very good. Now, can you just like wiggle a little bit? Does everything feel okay? The manipulations I'm doing should not cause pain, but I always like to check because it could be underlying problem to something else. Okay, alright. So now I'm just gonna run my fists over your shoulders. Okay. Over your shoulder blades. Okay. Alright. Now I'm going to do another adjustment where I put your head down and then we go back, alright? So I'm going to grab onto you here. Alright, just gonna grab onto you here. And we're gonna go down. And take a deep breath in and out. Okay. And then go back. And then we're gonna take a deep breath in and out. Okay, very good, very good. Alright. Alright, let me just assess again. I'm gonna probably have you walk the room again too. Just to see. Are you sitting straight for me? Okay. Yeah, that's looking a lot better there. Go ahead and get up and walk the same distance 2 times again. Alright. Okay, yeah, I can see that that's improved a little bit. I would suggest maybe coming back for an even more detailed adjustment, assessment. We don't like to do things too extraneous the first time, just because we don't want to overdo it. You know, it's best to do things a little bit at a time. So what I did was I adjusted these vertebrae right here in your cervical spine. Alright, there's three different sections to the spine: the cervical, the lumbar, and the thoracic. Okay, so it's good to keep everything in order there, but I worked on the 3 to 4 vertebrae around your shoulders. Okay, alright, just so you're aware, and if you have any questions, obviously you can ask them. Let me take some notes for all of these, and then I will send you over to her, okay? So, yeah, so we talked about pillow switching. You maybe even want to look into the firmness of your mattress. Okay. Yeah, okay, so but I would start with the pillow. Obviously, mattresses can be expensive, so I don't expect you to just, go grab a new one, especially if you can't. Are you feeling any pain currently still? Do you feel anything lingering? Yeah, you probably can't tell right now. So, the massage will obviously, like I said, help to keep your muscles loose and everything, so nothing gets too tense now that you've had this done. So, let's see. And then we fixed the unevenness of your shoulders. For now, we'll probably have to do that again when you come back. So all right. All right. I think I'm going to take you over to Louise now, and you can get started with her, all right? Okay. Yeah, just come this way.
Hi. So, you've had your appointment with Alyssa, and she's given me your notes, and she's recommended that you have a neck, back, and shoulder massage. Is that right? Okay, I'm going to start with your back. Can you just turn around for me, please? Okay, it might be a little bit cold at first. Okay. Okay, I'm just going to focus on the pressure points. How does that feel? Okay, good. I'm almost done with your back. I'm going to move on to your shoulders in a minute, okay? How's the feeling so far? Alright, that's good. Alright, I'm now going to move on to your shoulders. Which one usually hurts more? They're both the same, okay? Can you relax your shoulders, please? Okay, I'm going to start with this one. Does that feel alright? Okay, good. Alright, I'm going to move on to this shoulder. Okay. Can you turn around, please? Okay, now I'm going to start your neck massage. And which side usually hurts the most? This side. Okay, this side. Right, well, I'll concentrate on that side a little bit more, okay? Just relax. How's the pressure? Okay, good. massage session. I hope that you are feeling better soon. Take care